Weight loss trends tend to be cyclical, but you won't believe what's back in fashion now. It's called corset training. Women wear a corset-like device under medical supervision to help reshape their waist. Is it worth cinching up, even though some say there can be some dangerous side effects? Food and fitness coach Lori Corbett has the story.
What woman wouldn't want to have a 3-inch smaller waist?
No exercise, no surgery. Instead, squeeze yourself into this.
I came in for a little Botox and the new corset.
You wear your corset a number of hours per day, and over a period of time, maybe a year, you can move those ribs in, affecting a permanent change.
Moving the ribs sounds impossible, if not painful. But surgeon Alexander Sinclair says over time, the body accepts and adapts to a smaller waistline. You might eat less because it's tight. It's also sweaty business as water weight is lost. But the tapering effect is due to compressing bottom ribs both in and up, which makes the space between your hips and ribs look smaller. Something I had to try.
Actually, the doctor's having to work harder than I am, but one thing I'll tell you, it is tight. Incredibly tight.
While this resembles a Victoria's Secret ad, this procedure is done in a doctor's office, requiring a fitting with minimal clothing. Costing about $150, the corset is worn for 4 hours daily to start on the first set of hooks. Over time, you're advised to make the corset tighter in increments by advancing to the middle, then inner hooks. Then onto a smaller size.
Who's going to put a corset on and try to breathe like that and just for a smaller waist? Who would do that?
She would. Allison Feynman is being measured for her 4th corset in 5 months, having lost 6 inches, which concerns Dr. Sinclair.
Some of the patients are so happy with it, for them it's a race. They become very obsessive about it, so they're wearing their corset 14, 15 hours a day, which I think is too much.
So we went from a 30 to a 28 to a 26. I think this is, after this one, it's the last.
Yeah.
This is a 24-inch corset. This is the last one. After this one, I'm cutting you off.
Last time I saw it was on Gone with the Wind, and it can't be comfortable.
Or good for you. Dr. Andrew Pritikin says this style of slimming could cause problems like weakened muscles, constipation, and more.
Your joint movement is not going to be nearly as normal as it should be. The lungs can't inflate as well as they should because the ribs are going to be constrained. If there's any women out there that are wearing it with any heart conditions, that would be a red flag for me.
Dr. Sinclair's patients haven't experienced these issues, and he feels this protocol is effective if done properly.
I'm much happier if the patient does it over a period of a year. So slow and steady wins the race. You're eating in it, breathing in it, dancing in it, and so life goes on. You just wear it.
Lori Corbett, ABC 7 Eyewitness News.